In those trials, there was no evidence of a blood clotting issue. The second phase, which is absolutely routine when a new medicine goes into use, is a continuing surveillance process, and the UK has always been very particular about doing monitoring of any adverse reports that emerge during a vaccination programme. We've done this with previous vaccines, and so there's a continuous review of any adverse event reports compared to what would be expected in the population in the absence of the vaccine. This rolling review, observed against expected, goes on all the time. And that's why the agency, the MHRA, was confident that the problem the asserted problem of thrombosis was not actually an issue.
So what do you think it was that spooked some of these EU member states?
I'm not entirely certain of that, really. It could be that they had a cluster of reports. After all, thrombosis, which was the initial report, blood clots in veins, is a pretty common problem in the general population anyway. And bear in mind that the people who are being vaccinated preferentially are the older people and people with underlying health conditions. So if anything, you might expect a rather higher incidence of blood clots than you would get in the average population. So it may have been a cluster of these that occurred together, which is why it's so important to have a continuous comparison of what you're seeing against what you would expect to see in a population of that age structure.
What can the EMA do now to try and help restore confidence? Or is that down to individual countries? And let's say today we're going to have Jean Castex and Boris Johnson get the Oxford AstraZeneca jab. How much does that actually instill confidence in their populations?
I think it's very variable from country to country, this issue of vaccine reluctance. I've been very pleased to see in the UK that the level of vaccine acceptance has been extremely high, higher, I think, than had even been predicted in advance. But there are certain countries in Europe, I know France has this problem in particular, where there is quite widespread scepticism about the vaccine. And I think this has been made worse by the pause. I think it's been made worse by some of the statements a few weeks ago questioning the effectiveness of the AstraZeneca vaccine. And there's a lot of work to be done to restore confidence. The key issue to understand is that the coronavirus pandemic is costing a lot of lives, 2,000 deaths or more per day in EU27. That is a real public health emergency. And the way we're going to get on top of this, and the way we're going to prevent the third wave developing, is to ensure that there is a rapid, high uptake of vaccination. And I hope we can get that message across.